All
Good
right, well,
afternoon. This is Kevin Brown with the Kentucky Department of Education. Welcome to the Superintendent's Advisory Council meeting on June 22nd, 2020. I'm going to defer to Natasha Napier for a very abbreviated roll call.
thank you, Commissioner Brown. And I would like to also remind everyone that we are recording this meeting and we will post recording on our website. And taking care of inadvertently, once I'm finished, just unmute yourselves and let me know that you're present. So I have Superintendent Casey Allen, Houston Barber, Tom Cochran, Alvin Garrison, Scott Hawkins, Terry Price, Trace Settle, Greg Schultz, and Henry Webb. Is there any member to this council whom I have inadvertently missed?
Yes, Mark Kopp, I'm present.
Thank you, Mark. Thank you. Anyone else? All right. On a final note, I did place the agenda in the chat feature. If any of you need a copy of that, you can find it there as well. So I'll turn it back over to you, Commissioner Brown.
Thank you, Natasha. Obviously, superintendents, if you want to also use the chat feature to ask questions in lieu of raising your hand or in lieu of speaking, you're free to do that. We will monitor the chat feature for questions and comments. That is also included in the meeting record. We are also able to live stream this meeting. Today, some days we are not able to do so if there are other meetings going on. We only have the capability of live streaming one meeting at a time, but we are doing so, and obviously it's being recorded. So just keep that in mind. Obviously a busy week last week, a busy few weeks ahead, a lot of activity on social media in our communities talking about obviously COVID-19 but the anxiety that's building as we talk about getting back to school. I think this is certainly understandable. Our goal here is to work with our other partner agencies across the state and in state government and working with you to provide you the support you need to reopen schools safely and to give and also to do it in a way that is responsive to the needs of your community. So I also understand that there is frustration out there. I understand that there's some questions we don't yet have answers for, or maybe some questions we have answered, but we've not done a good job on my end communicating those to you. We're going to redouble our efforts this week and moving forward to make sure we have that communication to you. There's been a little bit of a change as far as our schedule of release of information. I had a very good conversation this morning with the governor and lieutenant governor and other members of the administration. Also working as we work with public health and others to, as you know, we are anticipating the guidance document Public Health's been working on the various aspects related to public health and COVID-19 that districts need to implement. And obviously, that is a companion guidance document that goes right along with all the other guidance documents that KDE has issued or will issue, and it will inform those as well. We had anticipated releasing that today. However, we have listened and we are hearing additional concerns and feedback. And so the governor is going to be releasing that document at his Wednesday press conference. We are going to spend today's Superintendent Advisory Council talking about additional issues that you have, implementation issues, to make sure that we are all discussing those at the state level to making sure that that is addressed in that guidance, and if it can't be addressed, the public health reasons why it can't or what other alternatives there may be. We will spend the superintendent webcast tomorrow, a large portion of it, doing the same thing we're doing today. And you've heard a lot from our public health folks. They're on the call today. They'll be on the call tomorrow. They'll probably be on many future calls. I think today they're going to do a lot of listening, and they may have some additional things to share with you. But we know what the buckets of things are that are going to be required. You just haven't seen that document yet. But they want to hear from you, the additional implementation details. I've had conversations over the weekend with several of you about things that we'll talk about later today that we want to make sure we're all aware of. For example, temperature taking and what happens when you have 2,400 students at a high school arriving within a 10 to 20 minute period every day, and then there's a severe thunderstorm outside. You can't do temperature checks of 2,400 kids within 10 minutes. So those types of things, we want to make sure we're hearing from you. Those are logistical issues that are keeping you up at night. We get that. And so that's going to be the plan for the week. In addition to the public health type document that's going to come out under the governor's Healthy at School plan on Wednesday during his press conference, we also anticipate the governor being able to announce the what we've previously had discussions about on how we are able to and going to be able to be flexible this semester, while many of you are going to be reaching out to educate kids at home, even though you are at the same time having in-person classes. That's going to take a change in how we evaluate attendance, how we distribute SEEK. The goal being we want to keep you whole. We don't want to provide an incentive or a disincentive for you to educate a child at home if you choose to do so in that environment. And that's exactly what we're going to do. We think we're going to be able to have that information to you Wednesday. I think Robin's going to talk a little bit about that today, I believe. Not sure. I'm a little looking at our agenda over here. And so that is good news. There are several different routes we could have gone on that, but at the end of the day, I think that's going to be beneficial to districts. We know you're striving to meet students and parents and families where they are, and you're already thinking how to do that. We want to make sure the state funding follows. So the bad news is we're not going to have a document for you today. The good news is we're continuing to work, listen to you, and that's going to come out on Wednesday, which is a short time away. Related to that, I did receive from a co-op director on Friday afternoon a list of about 7 things that was questions raised by that co-op director's members at a meeting that co-op director had last week that I am sure are similar to questions that you also have in your areas. So we're going to kick that off by going over those 7 questions that they had and try to get some additional. Some of these we may just have to have conversation today. Some of them may not have answers. Some of them have answers. Some of them we have given answers but have not done perhaps maybe a good enough job communicating that answer. And so we will go through those. That's going to kick us off. And then, of course, we're going to go to a Department of Public Health update and also a time for you all to voice your concerns to them, more so than an update about what they've presented in the past about temperature checks and masking. And so we can all take that back over the next 48 hours or so and work as we refine that Healthy at School guidance. So in the interest of time, I'll just go ahead and start out with these 7 questions. The first question talks about superintendents needing specifics on funding issues before they can think about anything else. For example, ADA, number of NTI days that will be allowed, et cetera, and that you all are still feeling great uncertainty. And Robin, this is what I was referencing a few seconds ago. If you can kind of walk us through what we are thinking about on that issue.
So thank you, Commissioner Brown. Last week, we had an opportunity to talk at lots of webcasts, including with superintendents, with our finance officers, and our DPPs. And in each of those conversations and webcasts that we had, we talked about coming up with the model that would give districts the most flexibility as you choose your instructional method, and at the same time, making sure that you're not having to worry about funding to the extent that then influences your decisions. So based upon what we heard, and we did appreciate the feedback that we did receive from all those groups, we heard about ADM as an option. We heard about just pushing forward the model that was set forth in what we closed this school year under, which was Senate Bill 177. And it is our recommendation that we move forward to implement that recommendation, that we would move forward with what was in Senate Bill 177, that is moving forward with either utilizing the 18-19 data or the 19-20 data, which was selected by local school districts. So you each made those selections on behalf of your district. We're going to recommend that we push that forward a year. And so attendance and funding will be taken care of for the next school year based upon that. However, we have heard very strongly too from interested constituents, legislators, school districts, also this need to make sure that we are reaching every student. And we all know with remote learning that becomes a little more challenging. With those that have the ability to utilize technology to its fullest degree, then we will look at toward participation. We will look at it for both students that are in person. We will be looking at participation to be counted through your check that they are in your classroom. And then we will also take participation remotely, either through technology, a login or something similar to that. And the other piece that we could still use your input and help with is how to really capture that participation by students that do not have the full access to technology. We still want to encourage districts to the extent that they can to continue to pursue and gain internet opportunities and provision of devices for those students. But we still understand there will probably be a small percentage, some percentage that's just not possible. So we really need help in capturing and evidencing what participation looks like for those students that are still under paper and pencil, whether that's reporting of projects, whether that is work-based. There is a great interest in us being able to prove and be accountable for reaching every student, no matter where they're located. So I'm going to stop for just a minute because I do think this is an important question that the Superintendent's Advisory Council can help us with. We understand that the good faith of all of our instructors and really trying to reach out to those students, but at the end of the day, someone's going to want us to be accountable and be able to provide evidence and proof. So other thoughts and ideas about how we might do that, we are very receptive to hearing those other ideas.
Feel free to speak up. You can also use the chat feature if you would like as well.
Hey, Commissioner. Henry Webb here. Hope everyone's doing well. That's a great point. I think we're all committed to meeting the needs of all of our students. I think the system we used in the spring of participation logs can be enhanced with perhaps having completion of assignment log / gathering of information. So each student who completes the assignments, that work could be gathered for each student to have that as supporting documentation. Just a thought, as I know we all want to make sure every student reaches his or her maximum potential.
Thank you for those comments, Superintendent Webb. Really appreciate that. Anyone else have any ideas? I see in the chat that David Rust has agreed with Superintendent Webb about collecting that participation through evidence of work product. So we'd have to think through what that would look like. I think I have shared previously that Infinite Campus is trying to provide with some reporting mechanisms for us so that we can take those participation. I'm trying real hard not to call this attendance. You can tell that I'm trying really hard not to call it that. I think we are trying to look for a participation so that we don't create confusion that attendance and funding are tied together. The participation is a separate component. Okay. Well, we would really appreciate your continued thoughts on that. We do envision there would be a reporting to the Department of Education like we did in the previous type reporting under NTI. And then we also envision that we would provide a report to the Legislative Research Commission at the end of the school year so that we can show that good participation by all our school districts.
Thank you, Rob. And just as a reminder, how this is going to roll out, we want to continue getting your feedback, but it obviously looks like we're moving towards this model that Robin described versus an attendance model where you're taking strict attendance for those sitting at home and strict attendance for those sitting in the classroom. That was problematic. And so how this is going to roll out is we're going to be asking the Lieutenant Governor to sign off on a memo from me under the Governor's emergency authority to waive some of these norm requirements that we would have in a normal year. This is the similar process we used and the Lieutenant Governor signed off on to waive the civics exam, for example. And then that will be followed up with, we think, a emergency regulation of the state board to put in place the plan and that criteria that Robin described. That will not happen, though, for a few more weeks until the state board comes online back into a meeting. So that's how that's going to be implemented. But as of Wednesday, we're going to be able to tell you in conjunction with the governor's Healthy at School announcement and give you clarity, and you can bank on the fact that you're going to have a alternative way and a way that we can flow funding to you for this next school year just because of this unique situation. The other side that I will add to that is this will be a great conversation starter during the next General Assembly about the future of education funding, because we will have a small taste of a little bit of an alternative because of the next semester and the unique challenges. But obviously, long term, it would take action by the General Assembly to change the overall SAC formula. The next issue that was raised by superintendents states as follows. Superintendents need guidance on proportionality of employment contracts. I think it was referenced that KSAA has been talking to superintendents, Wayne Young, about compensation when a teacher has a 185-day contract, for example, but only works 170 days. And so there was additional guidance being referred to here about that proportionality. Todd, can you comment on that? And then, of course, we'll reduce that guidance to writing as well, or refer back to any guidance that Wayne Young has put out.
Sure. And we've provided some guidance to superintendents who have asked for additional clarification on that topic. In reading the statute related to the variable student instructional year, sometimes referred to as the boat dock bill, there's specific language in there indicating if a school district moves forward in operating under the variable student instructional year, that 1,062 hours shall be calculated and considered the proportional equivalent to 170 student instructional days, regardless of the actual number of days that instruction occurs in the district. So for the purposes of reporting to KDE for your calendars, if a school district utilizes the variable student instructional year, once they satisfy 1,062 hours, even if that's less than 170 instructional days, the district will get credit for 170 instructional days. There's also mention in that statute of providing credit for contracts, employment contracts within the district. And it's been our interpretation that the same reasoning applies. If a teacher, for example, is on contract to work 185 days, which is the minimum required under state law, and the school district is utilizing a variable student instructional year, then once the district satisfies 1,062 instructional hours, not only does the district receive credit for 170 days for its calendar, the teacher would also receive credit for 170 days worked toward his or her contract. Now, they would still be responsible for working on a day-for-day basis for any remaining days, but so long as that individual, and we believe that it applies to both certified and classified staff, so long as their employment contract is based on the student instructional year, if the school district utilizes a variable student instructional calendar, once the school district reaches 1,062 instructional hours, the employees who have contracts based on that school year receive credit for 170 days worked. Again, we can provide the written guidance out that we have provided to a few superintendents who have asked follow-up questions on that.
Hey, Kevin and Todd, this is Scott Hawkins. Has there been any conversation with KRS and TRS that would not impact the employees' overall retirement service credit?
Superintendent Hawkins, yeah, it's interesting you mentioned that. The statute that we refer to as the Boat Dock Bill specifically says that for the purposes of TRS, the Teacher's Retirement System, the teacher shall receive full credit for the full year worked. It's silent with regard to classified employees who may be in KRS.
Okay, is that something that we need to follow up with them and work with the governor's office on? Because those folks who work less than 180 days, that would dramatically impact their service credit, and certainly don't want to do anything that would have a negative impact on our employees, because that's roughly half of our employees.
Let us reach out to KRS and ask that question to them, that if the district operates under the variable student instructional year and the classified employee receives credit for the full number of days worked, even if that's not the total number of days, if they would receive the same credit for retirement purposes.
Thank you. We would appreciate that.
Okay, thank you, Todd. And then we will provide a follow-up on that. The next issue that was raised was regarding food service, and superintendents have raised the issue of needing food service meal reimbursement on summer feeding payment structure. Robin, can you comment on that issue?
Commissioner, we actually have food service guidance on today's agenda, so I'll let them answer that more fully when we get to that presentation.
Okay, great, thank you. There's the next one I'm going to save for last. That's probably the one that'll be the most popular. Dr. White, we'll use that as a segue for you regarding masks and whether they are mandatory or optional. So I'll put that down, and that'll be a good segue into the public health segment. And we have about 3 more questions from the superintendents that were raised last week that we want to address. And Todd, this is you again. Superintendents indicating they need specific information on liability exposure with knowing that a portion of the student population will refuse to adhere to CDC guidelines.
Yeah, so I'm not sure that I can answer that question as clearly as I could the previous question that was directed to me, but I'll take a stab at it and provide some information that will hopefully be helpful here. I'm going to share my screen, and this is the PowerPoint presentation that I gave a few weeks ago regarding district liability considerations in light of COVID-19. This was on the superintendent's webcast that we conduct on a weekly basis on Tuesday. So, of course, I'll give the caveat that I can't provide legal advice to school districts and that you should all reach out to your board counsel for information on this topic. But I want to kind of go in here, if I can find the slide, on immunity, which is one of the topics that we discussed. We talked about the elements of immunity, and I think this question really goes to looking at ministerial acts versus discretionary acts. Recall that for those acts that require discretion, the exercise of judgment, personal deliberation, and decision-making on the part of school officials, so long as they're performed in good faith and within the scope of the employee's authority, they're going to be entitled to qualified official immunity, which is a good thing. However, there's no immunity for the negligent performance of ministerial acts. So if there is a law or a regulation in place specifically related to this topic of wearing masks and exposure within the classroom, then that would be a ministerial act, and there would be no flexibility, there would be no judgment involved in that decision making, and a school official would not be entitled to qualified official immunity. I think we've previously discussed that that would be problematic, and we talked about the insurance aspects of that. Here, the situation that we're facing is that that through the public health recommendations that we've been given, as well as recommendations that have come from KDE, superintendents do have some level of discretion in their judgment to determine how they're going to best implement social distancing, mask wearing, things of that nature, preventative measures within their school districts. And that may vary from district to district or even from school to school based on the unique circumstances of your population. I'm going to kind of hone in on the good faith and reasonableness standard in this situation. If you have a percentage or a sector of your student population that is refusing to wear masks, then the question becomes, has the school district implemented a policy that goes out to all of its teachers and staff that tell them what to do in that situation? If so, then the staff should follow those guidelines. As the superintendents or district leadership develop that policy, however, they have some level of discretion involved, and it should be very reasonable in nature. Obviously, we don't want to create a situation where it's just being ignored when students are not wearing masks or following appropriate social distancing. At the same time, we certainly wouldn't physically force a mask on any student. So unfortunately, I can't tell you exactly what your liability consideration would be in that situation. But what I can tell you is that you should speak with your local board council, and you should develop locally some very reasonable guidelines that you and your staff will implement in the situation when you have a portion of your student population that's not wearing masks. So for example, obviously you're not going to ignore the situation. You're going to take some steps to try to address it with the student to get them to put their mask on. If the student doesn't have a mask, maybe you need to take some steps to connect them with the Family Resource Center to see if they can be provided with a mask, if that's the situation. But ultimately, looking back, if there are any questions, if the district or an individual within the district gets sued, you want to be able to point to the reasonable steps that the district and its staff took to ensure some level of compliance with these guidelines that has been issued. So yes, Todd wasn't wearing a mask, but these are all of the things that we did. This is our typical procedure for how we handled this, and we handled it in that way for Todd whenever he did not wear a mask. We talked to him, we told him, Todd, you've got a mask, put it on. Or we noticed he didn't have a mask, so we referred him to the Family Resource Center to try to connect him with some resources to get those.
Thank you, Todd. And I think I think the next two questions are related to public health. So now, since we're talking about masks, Dr. White, we'll just go ahead and see if you have anything else to add. I'm going to put my public health hat on. I think I probably know more about public health than I ever thought I would or wanted to. And I think, Dr. White, you probably now know more about K-12 education administration than you wanted to. Keeping with what Todd said, things that I've heard you, Dr. White, say, Dr. Meserly, and of course Dr. Stack, is that the mask requirement, of course, comes into play when students are moving about, comes into play when they are going to be less than 6 feet apart. When they are 6 feet apart and districts and schools are able to have that social distancing and they are stationary. So let's say you have a classroom with only a certain amount of a small number of students in it, and there was that 6 feet buffer around, then the mask can come down and come off the face while they're in class, but of course go back on when they're going down the hallway. We've talked a lot about, and I've heard you say, Dr. White, we've talked about the department best effort, using your best effort to make sure that these public health expectations are followed, being reasonable. You may see some of the CDC guidance talk about when feasible. Obviously, when moving, when you move, you mask is something we were talking about last week, I think, at the task force. And, on one end of the spectrum, I guess the most forceful thing we could have is a state law saying everybody has to have a mask. On the other end of the spectrum, we have people just absolutely no societal expectation of a mask at all. And then in between, you've got regulations, you've got good faith expectations, you've got classroom management, school culture, a potential code of conduct, dress code, however that's problematic, but you've got all that in the middle. And I think one of the things we're facing is our society expects and backs up school leaders for students to have shoes on. Our society expects and backs up school leaders for students that keep their shirts on during school. And so it's generally not a problem to keep shoes and shirts on kids because our society backs that up. The problem we're having right now is, and this is, I guess, a little bit of a social commentary. I'm putting on my liberal arts background here. We don't have societal expectation of wearing a mask, unfortunately, and it's to some degree starting to become a divisive issue in our communities, and so that really is placing school leaders in a conundrum when they know that many, if not most, of everything they enforce in their schools are also confirmed by our society as being important and behaviors that are expected. Yet we know that we have a situation where there are people questioning the use of a mask. And I heard this morning on the conversation with the governor, there's a college sports team, I want to say Clemson, I'm not for sure, that 20 athletes, I think, tested positive. We're now hearing that Major League Baseball is having issues with spring training and perhaps some cancellations because of COVID-19. And I don't want any of those things to happen. But hopefully, as our community in Kentucky starts seeing that this virus is not going away and that things that we can do to mitigate it, such as wearing a face covering in certain circumstances, can help alleviate that will create that societal pressure. But we're a long way away from that. So I say all of that to say that, and I know, Dr. White, you and I have had these conversations, districts are really anxious about how this is going to play out when we get back to school. So I don't know if you have any comments, and we also, I think it's a good time to hear from our superintendents on the call as to what the concerns they're having about this issue, but also if any of them have any suggested solutions.
Well, I think, Commissioner Brown, you just made an A on your public health midterm for this semester. That was very well said. I especially love the no shoes, no shirt, no service analogy. You can throw in their immunizations as well. I mean, you don't let kids come to school if they're not immunized. Why? Because if they become sick, they will infect other children. And we don't want measles, and we don't want mumps, and we don't want chicken pox, or we don't want children to have, and then in turn their families have, any of these infectious diseases. And so I think the mask fits right in there. The more work that's being done by the CDC and other people who are doing research on this virus, the more we know that the mask may be the number one thing that we can do. And if you think about, again, I've talked about the respiratory droplets, the first way you can stop that is with that cloth face mask catching those respiratory droplets so they're not spread to others. I think I mentioned, I've been on so many calls, I don't want to repeat myself, but I feel like wearing a button that says, I'm wearing my mask because I care about you. I have an acquaintance who she's a sewer, she makes masks, and she wants to embroider "You're welcome" on the outside of her mask because that's truly what we're wearing it for. So I think if we see the mask as the closest thing to an immunization that we have right now, the closest technique we have to stopping the spread, it is the one thing that we can do. And I think if we have our education leaders see that as an expected expectation, and our faculty in our schools see that as an expectation and model that, it's going to make that harder for the students. Now, does that mean there won't be parents who are going to say, by golly, my little Joey's not wearing a mask at school? You probably had people that didn't want to wear shoes to school at one point in time as well. I'm sure of that. Well, because back then some of them didn't have shoes. We know that in countries where they have universal mask wearing, and there are some states that are requiring masks now, but in those countries where they have universal mask wearing, they are seeing their numbers go down pretty dramatically. So there's no question that wearing masks keeps and helps to prevent the spread. we are not just seeing this in Louisville and Lexington. If you look at our maps, we had a huge influx of this illness in Western Kentucky. And as we map every week where the outbreaks are, and you can just almost see it marching across the state as more and more people are being diagnosed. As a public health first person and as a physician, and I'm not a mother, so I can't say as a mother, but as a step grandmother, to me, the thing we can do for our children is to inform them how important this is and then have that expectation. And I don't know how far you can go, but listening to your attorney speak, you are going to have to look someone in the eye when there is an outbreak and say, we did everything we could to get kids to wear masks because we understood it was our best public health tool. Since I don't live in your world, I don't know how hard that is. But speaking from my side of it, that is the expectation that I think we need to have for our children and their families that they go home to. It's the families they go home to is my huge concern.
And Dr. White, one of the comments there in the chats from Superintendent Schultz talking about, maybe initially, and I'm putting words in your mouth, Superintendent Schultz, but I think initially we all thought several weeks and months ago, okay, there'll be a handful of parents or students, just like with any issue we have, of compliance and doing what we want them to do, that they're not going to comply. Well, now superintendents are starting to see, because they're going out into Walmart and the grocery and the dollar store, and they're not very rarely seeing a mask, unfortunately. When that becomes the majority of their parents and their students, how that, and I know you don't have an answer for this, but that is going to be a very huge issue that can quickly get away from a building principal. And I think we're all struggling on how to best deal with that.
Commissioner, you're dead on. Good job.
Yeah. Well, and I think as adults, we all want our children to be so much better than us. We don't let them cuss while we cuss. We don't let them drink. We don't let them do a lot of things that aren't good for them, even though we as adults don't always walk that narrow line. And so I think appealing, and I wouldn't even begin to preach to you guys on how to get parental buy-in, because you know that so much better than I do. But I'm very hopeful, excuse me, that parents will see this as critically important for their children to do the right thing, whether they choose to do the right thing themselves or not. And I will say my last trip to Walmart in Campbellsville, when I visited my mother, I would say that the masking had doubled. Now, it was pretty small, but I did see more in Campbellsville this last weekend. So I don't know if the numbers staying pretty stable or making people recognize that this has not disappeared. It is not going to go away until we get vaccination, or until we get every single infected person in self-isolation and their contacts in quarantine like they have in New Zealand. They have pretty well conquered this because everybody that's infected, they've done all the right public health measures, and so there aren't any active infections. We're nowhere close to that in Kentucky or any other state.
One of the things, Dr. White, that we're going to have to do at the state level is support our folks on the front lines as school starts. And, we've talked, and I know that's a public health does that. And, public health's always been about public health campaigns and outreach, and we're really going to have to do that. And we've talked about the department assisting public health and other state agencies like tourism that have contacts with famous people to do public health announcements, for example. But that may only reach certain people that are our ages. We need to be very strategic about, and this should be a national push because every state's dealing with this, about having some type of social influencing on TikTok. And surely if TikTok can influence the attendance at a presidential rally, we can use TikTok to influence the users of TikTok about the importance of wearing a mask when they're at school. And I know that's easier said than done, but the state will really need to commit to supporting districts as we keep moving about helping them and sending that message. Another question more specific from a superintendent on the chat is clarification about exemptions to mask wearing for students with asthma, other medical conditions, and then how that could create confusion for some students and some parents, because you're not going to tell other students and parents, well, this child's not wearing a mask because they have X, Y, and Z because of health protections. And if you could comment maybe on that.
Well, I think we see that in PE class, at least, again, going back 1,000 years when I was in school. But there were certain kids in class that didn't do certain things because they had a medical condition and they weren't allowed to. I don't think we need to have people wear labels that say I have asthma and I can't do this. But I think kids do understand that there are some kids that participate in everything in school and some kids that don't. Kids with heart condition. I had a friend whose daughter, she says, I can't swim, but I can do the time at the swim meet because if I swim, I turn blue. That was and she had a really horrible congenital heart disease. So that was what she did. So I think, again, it's that normalizing that there are certain people with certain conditions that can't wear masks. And I would think that you've got that in their medical record if there's a problem with being unable to do certain activities at school, and that would just translate into that. Maybe I'm making it simpler than it is, and I'm sure I am. But it seems like if we already know who those folks are, people aren't going to suddenly develop an asthma condition so they don't have to wear a mask.
Kevin, I think something too, just to add a little bit more to Greg's point earlier. It's going to be next to impossible for us to do 6 feet apart in a classroom. It's just not really going to be feasible. So at the end of the day, we're basically saying kids are going to have to wear a mask. And I think if that's the way it's going to be, then just tell us that's the way it's going to be so we can, communicate that and parents can make the decision on whether they're going to send their kids back to school. Because I think we'll be shocked at the number of people who won't send their kids back if they have to wear a mask for 6 or 7 hours a day. And but to think that we can have school with every classroom with kids 6 feet apart is just not feasible. And I don't think I'm alone in that. But I just don't see that being a realistic possibility.
It's my understanding the expectation from public health will be that just what you said, that if you are unable to provide 6 feet distancing in a classroom, which it obviously adds up quickly per student, that masking is the expectation when students are closer than 6 feet apart, for all the reasons that Dr. White said. I think that's a good lead in to there's a comment from another superintendent about a approach that district is considering, a phased approach to reopening. Phase 1 being 100% virtual for the first 9 weeks. I know of at least one district, I think in Western Kentucky, that's already said they will be going virtual for at least the first few weeks, and then providing 1 day a week for students voluntarily on separate days to limit numbers, which is addressing what Superintendent Hawkins is talking about, at least from day one, being a huge issue to be able to get everybody to comply. And then opening the ASPs for childcare during the day for a limited number of students. So that is, and then entering phase 2, and this superintendent says after fall break, bringing some students back in a hybrid model. So that's an option being considered there in Franklin County. That is one reason why, there's been some discussion as if we needed to be more prescriptive with how districts open. And we very much felt from the state level that it is important that we have local control. There was local control. You all happened to all close, but those were all decisions that you made based on recommendations from the governor, public health, and the department. We know that there are, even though we have so many similarities as Kentuckians, even from a district, from county to county, there can be differences in what the community wants in your reopening plan, knowing that there are still some basic public health considerations and expectations that have to be met. So we're trying to balance that. and not have a statewide criteria for opening and closing and when you're coming in and going out. Even though if the virus, of course, rose to a certain level in certain areas, it could get to that point. Another comment or question to be clear, will the guidance be that all kids must wear a mask to come to school and can only lower the mask when in a setting where every child is at least 6 feet apart, i.e. the cafeteria? It's my understanding that the public health document that will be coming out Wednesday, and this has been said by public health for the last several weeks when they've been talking to us, is that is going to be the public health expectation. However, as we started out the webcast, we know that expectation means you need to use your best effort. You need to act in a reasonable way, in good faith. There are times when a mask is feasible for a child. There's a time when it's not feasible. And so that is not easy for you all to hear because it still leaves a lot of ambiguity for you on the ground. But I think what Todd said and how he described it in the liability discussion about how to implement that of having acting in a good faith, acting reasonable, having guidelines in place, knowing that you have a way to address a child not wearing a mask. And I'm not necessarily saying it, or even recommending that it be in the disciplinary code or even the code or the dress code, but that you have a protocol for a student or a teacher to follow if a child doesn't have a mask, if a child refuses to wear a mask, knowing that it is going to be impossible for every child to be masked at every minute of the day in your school. I think we all go into this knowing that. Any other comments, issues you're dealing with?
Yeah, Commissioner, if I could just ask one more follow-up question to that. This is Henry Webb again. So if kids are wearing masks, then the 6 feet limit in a classroom is not required. Is that correct?
I think you're muted, Dr. White.
I'm sorry I did that so I wasn't shoveling around and causing noise. Again, getting back to the basic of the virus, it spreads respiratory. If you're 6 feet apart, you're probably better protected. If you're less than 6 feet apart, you need to have that mask on. As difficult as all of these things are, it doesn't change the parameters of this virus. And we have to work around the virus. It won't work around us. So yes. Now, does that mean you want to cram as many people into a room with masks on? Well, of course not. And I know you don't think that, Dr. Webb, but the more we can space, the better. And if we can't get the optimal spacing, then we need to mask the students and staff.
Thank you.
Mm-hmm.
I'm trying to think of things that could help us, Dr. White, and I read an article. Of course, the University of Kentucky will be requiring, as I read it, students to have masks on. And Tony, you may want to take note here that we will be seeing our UK football players, our U of L football players, our basketball players sitting in a classroom with a mask on. And I hope that as we see further examples of that, it gives some assistance to districts on the ground as they're trying to enforce that. But as I said, it's going to take a statewide effort to us to support that and support that type of culture until we get to a vaccine, because we know that is the best thing we have at this point. We also know, as I said, it's going to be imperfect. We know you can't have a mask on every child at every minute due to all the variations that you deal with, and the public health has recognized that in their guidance to date, and understanding that you've got to use best effort. There are times when it's feasible. There are times when it's not. We can move on to another question related. And then I think this is one that you've answered before, Dr. White, but I think we need some additional specific or additional direction. Superintendents need direction on what to do in an event a student or teacher tests positive for COVID-19 and whether or not a school has to shut down. And of course, that's a good segue into talking about contact tracing.
Mm-hmm. The more that you can do in cohorting your kids so that little Connie that comes to school, you have a pretty good idea of where she is all day long, and she is in his contact with as few people as possible, then when little Connie comes down with COVID-19, we are not going to have to look at the entire school. We're going to look at the cohort that Connie comes in contact with. And the fewer people that is, now, I mean, and I understand when I say that, I understand that's the simplest. I mean, I'm looking at the perfect way to do this would be as few people as possible. Then you would find out how much time and how close little Connie was, and did she ever mask on all the time. Once you know that, then you will know of the contacts that she had, how many are at low risk, how many are at high risk. And those high-risk kids are the ones that should go into quarantine, or faculty members, staff members. If little Connie is all over that school, then you've got a contact tracing opportunity that turns into a massive opportunity as you try to figure out who she was with and how long she was with them. And if that is an impossibility, then you may be looking at closing down large parts of the school when that really isn't necessary. It's just happening because we have an unknown. So the more that you can keep manifest and know when the contact tracer calls, the more you can know where that child was, how long they were in contact with people. And I don't mean you're going to be like watching them with security cameras. I mean, you know that Connie had first period at this class, and this is who's in that class, and second period, and then recess, or however that works. That will help the contact tracers not bring in people that don't need to be brought into this. Let's only focus on those people that little Connie truly could have infected, and let's get them out of the mix so they don't infect any others. Does that help answer that question? Then closing a school, then again, would go back to as you did make decisions on closing a school for flu. If you have a whole host of children that have an infection and go into self-isolation, then that's a different matter. If you're just talking about one or two students, that's very different.
And Dr. White and or KDE staff, I want to say that we've already issued a document, or the document coming out Wednesday does have a section on that very issue of protocols to follow when a student is diagnosed or has symptoms. Is that correct?
Yes, there's a section. And I think the most important thing, and Rob and I were talking about this, is you as the school system do not have a responsibility to do the contact tracing. That is a public health responsibility. But the more that you can help the contact tracer understand the whereabouts and the contacts that child has, the crisper that evaluation can be, the more targeted it can be, so you're not involving a whole bunch of people that don't have to be involved and putting your school at any chance of having to close down large numbers of your students and staff.
Dr. White,
Yes.
Trey Settle from Callaway County. Let's talk about siblings, obviously, who share the same household and contact tracing, because I've heard mixed information about this when it applies to temperature checks and things of that nature. I know the guidance will have more on temperature checks, but obviously, if children are sharing the same household, then I would assume that they are going to be in close proximity to each other at some point. And we've got maybe one or two that's in elementary, one in middle, one in high, and then that has implications for those schools as well. You would have to contact trace. Would you have to contact trace who the middle schooler and the high schooler has been in contact if they're under quarantine, because we know they've been in close association with their little brother or little sister who's tested positive? And then the testing for those individuals, how do we know when they're clear is there mandatory testing for anybody who shares the same household or someone who has been identified as a close proximity to the one who has tested positive?
So your index case is what we call the person that has come up that's positive, that is in fact we know is infected with COVID-19. So we go back and say, all right, when did that person start showing symptoms? And then our recommendation is 14 days after that is when we would see that they would be safe to go back to a school setting. We don't require them to have a test to go back to a school setting. So the medical healthcare professional that does the test and says, yes, indeed, you are positive and you may go back to school at this date as long as you are without symptoms. And the symptoms for children especially don't last that long. So the healthcare provider would write a note. If I were a principal, I'd want a note that says, yes, Johnny was diagnosed on June the 1st and it's now June the 15th and Johnny can go back to school. Johnny's siblings would go into quarantine then for that same 14-day period. If those kids in quarantine develop COVID-19, then you'd be going to middle school and high school and do contact tracing on them. But you don't contact trace. You don't have people that are in quarantine and then you contact trace them and then you contact trace. You're right. You would end up contact tracing, the entire Eastern time zone. So you quarantine the person that you know has the infection, and then you isolate the person that has the known infection and you quarantine their close contacts. And if they get symptomatic, then you can test them. And some people just want to be tested. That's a whole nother conversation about testing and what does testing mean. But no, you don't have to do contact tracing on the contact traced people.
It does. I think there's just a lot of confusion about symptomatic individuals versus asymptomatic, and if the asymptomatic people are in fact contagious or not contagious, and that's where the confusion lies. And if there's going to be a need for contact tracing to identify people with symptoms, then are those people who are asymptomatic not equally as a threat to their peers as those who are symptomatic? That's the confusion, really.
And that's a really good question. So we're finding, depending on what group you look at, between 20 and 40% of positive tests, the person is asymptomatic. So you're exactly right. How do we know if I've got the infection? How do I know if my brother, who has no symptoms, is symptomatic? Well, you do that by keeping them at home for 14 days away from everybody else. So even if they're asymptomatic, we're not letting them get contact with others. You can about 5 days afterwards, because 5 to 7 days is usually how long it takes for this virus to actually show up in a test. You could check that person in 5 to 7 days and see if they're positive. But if they're positive, you're going to have them stay home for 14 days. If you don't test them, you're going to have them stay home for 14 days. But you can be infectious and without symptoms or asymptomatic. The other people that are infectious are, I go and get a test today and I'm positive for COVID-19. My symptoms started yesterday. That's Sunday. That means Friday when I was at school, I was infectious. It took 48 hours before my symptoms to show up. So that's why contact tracing figures out when we think you've got the illness and then goes back 48 hours. So that's another thing that might be confusing for people. If you get a call on Monday and say, Connie's sick and we need to check everybody she was with Friday, it's like, well, Connie just got sick today. What are you doing? What's the deal with Friday? Well, the deal is you can be completely asymptomatic the whole course and never have a symptom and still be infectious. You can be pre-symptomatic. The 2 days before your symptoms start, you're infectious. And then obviously when you have symptoms yourself, you're infectious. But that magical 14 days is when this should all go to the point where that person is not infectious anymore. Did that make it simpler or more confusing?
More confusing, but that's okay. We'll deal with it.
I'm sorry.
Well, it's just, you could have that child, they share the same household, and as you point out, you tested positive on Friday, and we're going to quarantine the whole family for 14 days, but little brother who's in the middle school didn't actually have that contact until day 5 with their sibling, and they got it on day 5, so you're going to put them back in school on day 14, but actually that's 5 days premature because they didn't get the disease until day 5, so they need to be out 19 days instead of 14. But I understand there's no good way to do it. We're doing the best we can.
And the contact tracer, let's say, for example, we'll go back to me. So I had symptoms yesterday, and my little brother in junior high was on visiting grandma in the farm for 4 days. So he didn't have contact with me until tomorrow, the next day. Then that's when his 14 days would start. It wouldn't necessarily, it will start from the time that my brother was exposed to me and could have gotten infected. And if I'm in isolation, I really ought to be staying away from my family members too. So I'm not, so that somebody who's not infected wouldn't get infected from me. Although living in a small household, you're probably going to get exposed. So that's what the contact tracer will ask a gazillion questions. That's why we call them disease detectives. And they'll try to sort all of those details out that you just said. But what we need from you and your team is as much information as you give us so we make that right decision and don't drag people into this that don't need to be dragged in, but cover enough people so we don't have spread.
Superintendent Schultz.
Thank you, Commissioner. Just a question. I know locally, our local district nurse has been having conversation with our local health department and really battling with many of the precursor signs to COVID are also very much seasonally allergy related, scratchy throats, a cough, things like that. The whole 14-day thing, we could be sending a lot of kids out of school for extended periods of time when they're not experiencing anything but the Ohio Valley crud. Any thoughts or guidance on this?
I think it's going to be, because of where we are right now, it's an expectation that if I have symptoms, I need to be tested. And if I'm symptomatic and I'm tested and that test is negative, then I get a note that says Connie has Ohio Valley crud, her COVID-19 test is negative, she can go back to school. And that's what you guys take to the bank. But you need somebody besides you making that call for you so that you're not liable on making those calls and you're doing the best you can for your students. It's a good point. We're also going to have flu here coming up soon. And we had a terrifically bad flu season this last year. So we're going to be looking at flu and COVID, and but you don't want them there if they've got flu either. So
Comment on the chat about how the public is concerned about the mask requirement. There will be just as much concern about keeping students home for remote learning without the complete reopening of daycares. This obviously affects both parents and students participating in remote learning, and our teachers, a major hurdle to overcome across communities. And I know this is on the radar screen of not only public health, but other agencies within the Cabinet for Health and Family Services on daycares and how all that works together. That's a very valid point, Superintendent Rust, and one that we're going to have to monitor, and that districts are also going to have to be working with their local providers, particularly if they do go to some hybrid type models. And then another question about taking temperatures. Can parents and guardians be asked to take temperatures daily, just as staff, before they enter any board property? Ensuring every kid's temp is checked daily is much easier said than done. And so before I turn it over to you, Dr. White, to discuss that, we've had some conversations about an assurance that parents could assure in order to at least get kids on the bus, and that by putting their child on the bus, they are assuring the district that before they get to the bus, they don't have a temperature. However, and we're still in discussions with public health, I believe we've arrived that might be feasible, and we hope so. However, I do think that the temperature taking upon entry to school is something that is still going to be a public health expectation. Is that correct?
Yes, if I'm a principal, and I know that's a scary thought to y'all, just as scary as it would be to me, but if I'm a principal and I've got a child that I let in the front door, and about 2 p.m, that child is not feeling well and is checked and has a fever, and that means that child has gone through that whole school day and exposed in an unknown number of kids and staff to COVID-19. And I could have caught that child at the front door who had a temperature of, say, 101 that morning, and you not checked the temperature and have essentially allowed this child to really wreak havoc with what's going to happen after that child is finally diagnosed. It's payoff, it's trade-off of what you're going to do. If you let parents attest that the child is getting on the bus, say febrile, and then they get to school and their temperature's checked and it's 101, then all those kids on that bus are going to be in a quarantine situation because of the close proximity of where they're going to be. So I think it's a huge lift. I can't even begin to imagine what a lift it is. I know on the other end what happens if you don't do that. This is going to expose you to an awful lot of work on the child that slips through the system. And I will tell you, I have not, having no children, I have not talked to a parent yet, just in passing, when I've talked about kids and fevers. And every one of them who are parents has said, oh yeah, I loaded my kid up with Tylenol so I could get him to school. I've done that all the time. I know I shouldn't have, and laughed about it, but that terrifies me, quite frankly.
And that's,
Yes.
I'm sorry, Commissioner. This is Henry Webb. I asked that question, and the scenario you just gave, we wouldn't catch them anyway with the temperature if they had Tylenol. We all know that there's temperature reducers.
Right.
So just like if we're saying we don't trust our parents to check temperatures, which I get it. Some people are going to have their kids go to school so I can go to work. But my concern is the flip side of that is simply we are requiring everybody to check temperatures. And, some of our schools are large. And even if 50% of the kids are there, you're still talking 800 or 900 kids. Let's say you missed 50 kids because your process didn't work that morning. It's pouring in the rain. We had to get everybody in faster than normal. And then we miss those 50. We're requiring it to happen. And then that kid infects 20 people. Now we violate our own policy because we didn't check that temperature when it was virtually impossible to do because it started snowing, it started raining, everything was chaotic. How do we deal with that?
Well, I think that goes back to the legal state of just because you can't fulfill that policy 100% doesn't mean you shouldn't have it. It means you're doing your best effort and you've got a policy in place, and nature and the weather hindered it and it wasn't done perfectly. But you are doing the best you can do to get this done and get this done appropriately because you understand the importance of why it needs to be done. And I think that's something that your legal counsel can answer better than me.
Thank you.
The temperature, and I would put it probably 3 different boxes of kind of final issues. I think that causing a lot of anxiety. The mask issue, of course, we've talked about temperature taking and social distancing, and they're all related to each other, but they all have their separate problems. That's one of the things about the temperature taking, that why we are delaying this guidance today is we want to continue to have those conversations between agencies to try to address the logistics that Dr. Webb, you've identified. I talked to some superintendents over the weekend. They identified the example given to me, Scott County High School, for example, 2,400 kids. They all arrive in about a 20-minute time frame. Even if the weather's good, particularly the first few days, if you don't have that process down to take those temperatures, and then you want the kids to be 6 feet distance apart, that line's going to be very, very long. And then you factor in if we have bad weather, and then of course when weather gets colder, a lot of logistics and about whether or not there's a period of time that a district would have or a school would have to take the temperature. Maybe it's during first period, and then that would increase the number of kids, as you said, Dr. White, that would be exposed, just like if they got on the bus with it. Mm-hmm. We're trying to, though, explore those logistical options and problems so we don't set up districts for failure, while at the same time being true to the public health need to do this. So this is great feedback, I think, for all of us to hear this and these challenges, and will inform the final guidance coming out Wednesday. Dr. White, do you have any follow-up to that? If you're welcome to stay on for the remainder, we've got about 3 other topics. This has been helpful, I think, to us. I think you're going to be on again with us on the superintendent webcast tomorrow.
I would just say that we don't have a treatment, we don't have a cure, and we don't have a vaccine. All we have is social distancing, masks, temperature taking, and hygiene. That's all I can give you. And if you can't socially distance and you can't wear a mask and you can't figure out how to do that creatively, then we will have more cases. And that's, I can't change that. I would love to, but those are the metrics that this virus works in. And staggering arrival times. I mean, other people are figuring these things out, and none of this is easy at all. I hear that, and I won't say I feel your pain. I have no idea what your pain is, but I do recognize that there is some. But we have a deadly virus that we have very little tools in our toolbox that we can use, and so. And we're not the only state that's having these issues. I mean, other states are trying to figure this out too. So, as I said at the very beginning, schools have been the bearers of all social change that we've had in our country. And I know you guys are creative enough to figure out a way to make this work that's safest for your students and your staff. And I'm sure that you will. So I'll be available tomorrow then. Is that what you need?
Yes, if that would be great on the superintendent webcast, which is 2 to 4 tomorrow. That would be great. I know you are servicing other agencies, but I appreciate you all being able to have time on here, particularly this week when we're anticipating this guidance. I think it's very helpful.
Well, you guys are our priority right now, my priority.
Thank you. Dr. White, it sounds like if I were an enterprising bus manufacturer or entry door manufacturer, I would be integrating some sensors on temperatures. That's probably the next phase of what we're going to see. Well, I'm sure, but that will come with a high price tag for districts.
Yeah. All right. Well, thanks very much for having me. I always learn a lot. Thank you.
Thank you so much.
Bye-bye.
Next, we have Dr. Marty Park. He's our Chief Digital Officer. He really needs no introduction as you all interact with him regularly. He's going to provide an update on alternative learning models. And we have a guiding question. I know you all love these guiding questions. We have found, though, it is a good way to help to develop the conversation. In terms of, and the guiding question is, in terms of alternative learning strategies, what are the most important barriers to remove or reduce in order to provide as much freedom to design to our district school leaders? Dr. Park?
Thank you, Commissioner Brown, and thank you all for the opportunity to be with you today. Listening to the questions come in, I just want to first say what an awesome job working with superintendents across the state, and what an awesome job of leadership that we're going on. Kentucky's special. We all know this, that we connect with each other extremely well. We share the things that are working really well, and we scale super fast. And that's what we're hoping to do here with this next section for design, which is getting into learning experiences and alternative learning design strategies or models that make sense and that are working. And so we wanted to take an opportunity, and you've seen, and we've been able to share over the last 3 to 4 weeks the additional guidance that's gone out. And these are this piece is trying to push on, as we've studied other countries and other states, design opportunities for us to come together and think through once we solve the questions on funding strategies, which I'm super thankful for Commissioner Brown and Associate Commissioner Kinney and others for sharing that today and being able to launch that message as soon as Wednesday. One of the as we think about the design of reopening in the fall, the first question is that we've received over and over again, rightfully, is making sure that there's not a disincentive or an incentive from a funding perspective, and super thankful for that as we move forward. But then our next questions start to get through once we think about logistics and requirements and guidance from a public health perspective. Then we're able to transition into learning design and experiences that we're offering to students. So as we've shared over the last several weeks, some of the models and strategies of hybrid approaches of having students who are staying home, as already mentioned, Dr. Webb and others have already mentioned that we're already seeing, and sometimes anecdotally at this point, where our parents are giving strong feedback that either they're not ready to send their kids back to school, maybe they have high health risk at home from a health perspective, or on the flip side, that some of the guidance or protocols that we will be implementing have families in a position where they don't want to send students back to school, like wearing masks and other protocols that we put in place. And so we find ourselves trying to think through and learn through with each other the best designs possible. So the guiding question is something that we wanted to throw on the table to discuss today. You've seen the strategies already, the models of trying to think about the flexible variables, which we've released in the guidance work. And again, this additional guidance on alternative learning design strategies turned quickly with some visuals, turned quickly into a 10 to 15 page piece where we're trying to help each other push through and think through. So whether it is a strategy that involves scheduled rotation of students with flexible variables like groups of students, groupings of teachers, days of the week, weeks of the month, may be a flexible point. Another variable might be times of day, so flexible start times, and to work through the protocols like temperature checking and things like that. As Associate Commissioner Kinney mentioned, once we can transition and think about participation in new ways, then that helps us really move forward with some of these flexible variables and not lock ourselves into starting at the same time of day maybe that we have started for a really long time, and not keeping a bell schedule in the same way that we've done in the past. And so really opening up to opportunities for participation wrapped around some of the new protocols. And so whether that's a strategy built on scheduled rotations, whether that's a strategy that is a synchronous hybrid model where we have students who are opting in based on the resources that they have at home to be live connected with intentional interactions between students in their classes or courses and teachers. And so understanding what that hybrid model can mean for us while students are connected live back to live learning sessions by teachers with additional co-teaching as options to help us move forward, or a combination. So what we've said over and over again, which we believe in, and working with you all throughout the state, it's about customization. And it's about trying to figure out, as we customize what these experiences can look like and feel like and be like, what are the additional hurdles that you need help with? We're working through, as Commissioner Brown mentioned, the funding conversation and working through that hurdle. And so as we design, maybe it's an online and virtual, which we also combine key terminology like digital, distance, remote, alternative learning structures that we need to release information and guidance on to remove additional hurdles for you is kind of what we're all about now to take this next step. I personally believe that as we transition from some reviewing of content and building off of relationships that were already established last school year to close last school year down to end the year, we had already developed relationships. We had already launched most of our content introduction. And so we had a lot of review work. And now we're entering into an entirely new design structure while we're trying to build new relationships between teachers and other students in classrooms, whether that's online and remote or in person, and reducing the number of in-person students in a classroom, allowing for more social distancing, so that so that we can get to opportunities. Maybe that's a number of students in a classroom that we can achieve more social distancing. From architect plans that I myself and others have studied, that may be 10 to 15 students per classroom based on an average class, physical classroom size, with some restructuring of furniture and things like that. So as we transition to customization and thinking through what's best for you, and we think about digital, distance, online, virtual, I'm throwing all these words out because we're using all of them, all of us are using them, then how can we help from a design perspective as we're launching new content for the new school year and reopening in the fall, as well as developing new relationships in new ways. So our key point right now, we believe, and we'd love to hear from you and think through what hurdles are in place, but we believe are targeted around professional learning. That's our next step, to focus on onboarding of teachers into new design spaces. That's potentially with learning management systems and new digital tools that, whether that's devices to students and teachers that may have not had them before. And so as we implement more and more from a technology connected perspective, then what is the professional learning strategies that need to come into play as quickly as we can? So in the guidance document, you'll see a really strong push on what we're referring to as strategy suggestions. So feedback and surveys. If you've not yet developed, and again, this is already feedback throughout the state that we've received that we're trying to build some coherence around. But if you've not yet developed parent survey to get real feedback from parents and stakeholders and your community on the feeling, on things like digital readiness, on things like how comfortable parents are feeling at home, because we know that we're going to have a percentage of students, as mentioned already, that will stay home, will choose to stay home and connect and work through remote learning experiences. Another suggestion is ownership, and this is found on page 7 and 8 of the guidance document that was released two weeks ago, but ownership of digital and distance remote learning strategies. So on top of your larger plan for reopening in the fall, someone targeting ownership of all of your digital and distance and remote learning and how that plays in, that will involve professional learning conversations as well as technology related conversations. The professional learning plan, as mentioned, in the document, we released a design toolkit that we are continuing to develop on throughout events throughout the rest of the summer. We want to work with you from a customization perspective. Our field staff are ready to engage more deeply, and they already are with some of you and many of our school districts right now from a design toolkit perspective of what types of professional learning make the most sense. And so from a entry point, maybe that's learning management system based structured learning design. And maybe then there's next level things like digital feedback protocols and mechanisms that we need our teachers to engage in, and maybe formative assessment practices digitally and connected online. Communications and parent onboarding is another strong push that we know that the onboarding from a parent perspective needs to be strong. Consistent communications methods and protocols with parents. I'm a parent myself of awesome public school kids, and to experience that myself of what the consistent communications protocols look like, so that I don't have overload of trying to figure out where I need to go to look and find, and that these are strong things to start the school year. And then finally, substantial education technology integration is an area that we know that we have to continue to develop on throughout the state. So I want to pause here, and I know I didn't go through the PowerPoint referencing what Commissioner Brown has referred to as playbook in your back pocket, which is fine. So if we can turn the slide, stop sharing the slide deck. You've already seen the models before. We really wanted this to be more of a conversation getting at that guiding question about reducing or removing or eliminating as many hurdles as possible so that we can accelerate as fast as we can. So are there any, I want to pause and get into some of that, some of your ideas on those guiding questions, and maybe you're not ready to talk through those just yet as we start to remove the funding concerns and some of the other logistical and protocol guidance based from public health as we work through those. Maybe you're not ready for additional push yet, but we wanted to provide this time. So I'll pause.
Any feedback, or questions, feel free to comment or put that in the chat feature as well.
And again, as we transition to the next topic, we know that district by district and school by school, the customization, once we come up with our overall strategy, maybe that's a hybrid model. As we've already started hearing and seeing in the communication to parents of, again, district by district, what the plan is. We want to continue to walk through with you and help as much as we can. And most certainly, we all want to continue to connect with each other and share as much as possible all throughout the state on what designs we believe are working best and most helpful. And so please feel free to reach out. Again, our field staff team is more than prepared to work through and talk through some of the design strategies with you and additional toolkits, whether that's professional learning related or other from a technology integration perspective. So thank you so much.
Thank you, Dr. Park. And of course, if you have comments or feedback on this as we proceed through today's meeting and you want to leave those in the chat is archived and we go back and look at that. And so sometimes that happens in a meeting obviously, or if you're think about it later tonight, just feel free to email Dr. Park. Next up, we have David Cook, who also needs no introduction, the director of the Division of Innovation at the KDE. And he's going to talk about intermittent closures. And there's also a guiding question about what factors should KDE consider when helping districts prepare for intermittent closures. David?
Thank you, Commissioner. Yeah, I'm going to not take too much time. You all heard this presentation if you listened to the webcast last week, but hopefully we'll get a little bit more interaction on this call today. My presentation is really about the readiness plans, what you're doing that's part of your overall reopening plan, but specifically around what are you going to do if you have to actually close school as you did this last spring. And how that looks in different ways, particularly around the length of time that your closure may be occurring. So this is the opportunity for us to think through what we in my office, my division, call traditional NTI or regular NTI, and the COVID closure that you did last spring, which was the first time we ever used NTI for an extended period of time. So there's some aspects of that regular NTI that may be necessary to think about as you ready yourself for the possibility of a sudden, and I use that word very specifically, a sudden closure in the fall. So next slide, please. So in that regard, we think of intermittent closures kind of at three levels. The first two are both the way we would have thought about them in a regular NTI sense, just a different reason for the closure. So these are all closures that we are talking about related to COVID-19. you still could have closures since all of you all have a application into us for NTI for next year. You could all use your, you don't have to, but you could use your NTI if you had a snow day. You could still do that. So it's all encompassing at this point moving forward. But what if you needed to close school for a day or two just to clean the buildings, do whatever you might need to do? It's not really an outbreak or anything in your area. It's just that you feel like you need to shut school down. Well, in those cases, you may not use, you may just actually close school and not have anything going on, just like you would have done during snow days in past. The midterm closure is probably very likely to happen, which is because of whatever reason you need to close for a week to 10 days. In those cases, we highly recommend that you follow your processes for remote learning for non-traditional instruction. And these are a little bit more like, they contain elements of both a short-term and a long-term closure. And then, of course, the long-term closure, which we would expect to be your plan for when there is some sort of a public health announcement that requires you to close for a long period of time, as was the case this spring. Next slide. So we divide this up, these closure recommendations, into common elements and variable elements. So there are things that are common regardless of the closure type. And those three things, the first one I'm not going to go into great detail because Dr. Park just did a really great job of talking about that, and that is, it's really crucial, and we've found to be pretty much universal across the state in talking to people about the successes they had with NTI, that it's best, NTI works best when it's not something that is different than the way kids think about school regularly. It's just a different location. And what I mean by that is when teachers are designing all of their learning, all of their instruction using systems that are digitally based, doesn't mean you have to deliver them digitally, but they are platforms, then shifting from remote to face-to-face learning is less of a factor when you have built something that can be used face-to-face, used on paper, or used digitally in a remote situation. So in designing your instruction in a very integrated kind of way is crucial to this planning process for closures. The school-owned technology and obviously school-owned instructional materials. The thing that's the point here is to make, and being ready for sudden closure, is make sure that you sort of have it in a frame of mind for students that if they have school-owned stuff, that they're taking that stuff home regularly, even on days they may not actually need it, because they may not know, maybe, oops, tomorrow we have to close school. So it's just important that you sort of get in those habits of those kids being able to be ready should sudden school closure be necessary. Next slide. I'm going to go through the variable elements very quickly. The three that kind of pop into the picture almost universally, but they're different processes based on the length of closure. Again, short-term closure, you may not do anything. You may just close school. And if you do that, that's fine. But if you do decide to close for a couple of days, then you want to make sure you're following your NTI approved application. Again, submission of work this is sort of how it's done in a regular NTI day. It's not that big of a deal, because what you would do if you close for a couple of days is everybody that's not digitally based would bring their work back with them to school when they come back. And that's pretty simple if you're closing for just a couple of days. Food services, you probably are not going to get into an extensive plan on a short-term closure around food services. So that just being thoughtful about that. Those midterm closures, again, those I see being possible for the fall and the 2020-2021 school year. Again, you should probably use your NTI approved application for a 3 to 10 day closure, just because it makes things more uniform across those days. Again, student work and the calculation of participation can still be done probably on a return to school or twice during the closure. You could do that. And then, of course, food services is that you're kind of getting to that place where maybe you do want to have some sort of ability for kids to get grab and go or whatever the case might be for medium-term closure. Then those long-term closures, those ones like we just finished, this is where the district needs to really have a thoughtful plan in place. And I want to thank all of you all, the kinds of things we're seeing in the applications for the fall. The first thing that I'm really excited about, and Dr. Park will be too, is a lot of districts who were very paper-based during this closure in the spring are actually sharing in their NTI applications. We're shifting and we're making this a digital first kind of mentality, and we'll get paper to people that needs it, but we want as many of our kids to have digital access. So we're going to beef up our efforts around devices and hotspots and all of those kind of things. So, but you still have to have that process in place. How are you going to collect that paper-based work if you have it, and so forth? Because we had those issues this spring. Because of people not being able to be together and those kind of things. So, and then food services, you all did such an incredibly phenomenal job with the number of meals that you provided kids. These long-term closures, again, would probably look a lot more like that moving forward. Next, thanks. The last thing I'll say is there's a few other things that you might want to consider. Dr. Park brought up the last one on the screen, but your deployment of your classified staff could look different based on the length of your closure. A short-term closure, you may just have certain classified staff role groups who just make up the time later. They don't actually, they're not there. Thinking about sometimes food service workers or possibly bus drivers, so forth. The location of staff, again, based on what public health is saying, if you're going to close, do the teachers still come to the buildings to do their interaction with students on the remote level, or do they stay home too? And finally, we've talked about this, is in a long-term closure as opposed to, short-term closure, if you do choose to do NTI in a short-term closure, you probably might just be reviewing stuff that just got introduced to the class the day before, because you're only going to be gone for a day or two. But as you get to those long-term closures, you have to start to think about it, and that's why the instructional design is so important, that it be digitally flexible, or delivery flexible, I should say, so that you can think about when new content is introduced. Because you couldn't, if you were doing another 40-day closure like we just had, you couldn't do just review content, obviously. So those are the things that we want to think about. Those are all just parts of, as you think about your reopening plan. Sometimes I think a few of those things, like your devices and your textbooks and those things, are maybe sometimes forgotten about or not thought about. But you need kids to always be prepared so they can have instruction if a sudden closure is to happen. So I'll stop there, Commissioner, and if there are any questions, I can answer them.
Thank you, Dave. One thing I would add, I know this has been a frequent question, we are going to utilize the governor's emergency authority and or the State Board of Education's emergency reg authority to grant the commissioner the ability to give districts the basically an unlimited amount of NTI days for the upcoming semester, school year. I know that's been a question. That is going to happen. So just want to make sure everyone knows that. Any questions or feedback, please feel free to speak up or put that in the chat feature. Also want to thank all of you that all 172 school districts applied for NTI, understanding and knowing the situation we face when we only had 80 this time last year is a huge undertaking by districts. It shows that you all are trying to do the best thing for your community in very uncertain and trying circumstances. I really want to thank you all for that. If you have any other feedback, feel free to include that. And of course, as always, you may contact David Cook directly. Next up, we have food service guidelines with Katie Embry. She's with and Jennifer Langfels, both with our Division of District Support and the Division of School Community Nutrition. The guiding question here, what is your main concern regarding food service in the fall? Does your district plan to provide meal service to students physically in the school building, as well as those receiving non-traditional instruction? Again, something that an issue that we've never seen before, providing services, food services in both locations potentially, and another innovation. And just an example of districts trying to serve kids where Katie and Jennifer.
Thank you so much. Thank you all for allowing us to speak to you today. First, we just want to say thank you for all your efforts in supporting the child nutrition program initiatives that are currently going on. We have a small update on the Pandemic Electronic Benefit Transfer Program. The application will be open until July 10th. So if you have families who are eligible to participate in that and have not had the ability to do that, make sure that they know that there's extended time. Next slide, please. Throughout the spring and summer, the USDA has provided many waivers of program regulations that allow the current models of providing meal service possible. These waivers allow schools to serve and claim meals on NTI days, provide multiple meals for multiple days at a time, allow households to pick up meals and take them home, allow schools to deliver meals directly to households. However, now, these waivers are set to expire in late summer and early fall, and without these extensions of waivers, these meal service flexibilities will not be able to be utilized for school meal programs. SCN is very much aware that many districts are preparing reopening schedules that involve students utilizing NTI days during the week to reduce school building capacity, and would like to be able to provide meals to students on days when they are receiving instruction at home. We are currently working with USDA to ensure that they understand the importance and the urgency of allowing schools to continue to operate with waivers in the upcoming school year, and we are very hopeful that additional guidance will be released in the near future. We are in the process of writing state-level waivers for the National School Lunch Program so that we are proactive in the event that nationwide guidance is delayed. With that being said, for today's presentation, we will only focus on meal service operations that will take place in the school building for enrolled students. Next slide. It's also important to note that this guidance focuses only on school meal sponsors that operate the National School Lunch Program, but many of the basic tenets of these recommendations can be applied to all meal service operations. Each district will need to come up with their own individual plan given the number of students and the layout of the buildings. The four main areas of consideration that we will discuss today include the meal service environment, meal pattern, food safety, and operational support. Next slide. To begin developing a food service operation plan for your school, start by identifying locations within each building where it may be feasible for meal services to be provided and or consumed. This may include delivering and serving meals in classrooms, gyms, or other large open areas. It may include serving grab-and-go meals that can be taken to other locations such as gym or classrooms. This may also include setting up the cafeteria for traditional use with adjustments made to allow for reduced capacity. Multiple methods may need to be used simultaneously in order to be able to provide all students access to school meals during breakfast and lunch. Any service model that is utilized must be able to allow for physical distancing guidelines to be observed and enable contact tracing to occur in the event that an individual receives a positive diagnosis. Next slide. Meals should be served in a supervised, non-congregate settings. It's important to think through all aspects of each meal service in order to identify any additional equipment, supplies, or staff that may be needed for meal service methods that will be used. Another important factor that must be taken into account is the amount of time planned for meal services. Extended meal periods may be needed to allow for adequate time for students to wash their hands, and for staff to provide multiple meal service models simultaneously for staggering meal service periods so that the arrival and dismissal times limit the amount of contact standards, or limit the amount of contact between students in high traffic areas, and for staff to implement enhanced sanitation and standards, such as cleaning all high-touch areas between each student use. Another consideration for the meal service environment is ensuring that all self-service of food is eliminated and the use of share tables and sharing of food is prohibited to reduce the amount of shared contact services. Next slide. Food service staff must be mindful to follow proper procedures to ensure student safety as well as their own in mitigating the risks of exposure to COVID-19. Although district protocols already exist for illness, staff must take additional precautions at this time. Staff should follow district protocols for temperature taking upon arrival to work, and staff must wear appropriate personal protective equipment, such as a mask, and follow district protocols if they experience symptoms so that contact tracing can be done if there's a positive diagnosis. It's important to create a culture of food safety so that all staff are working together in reducing the risk of exposure and transmission of the virus. You should also anticipate staffing shortages that may occur due to illness and develop potential staffing contingency plans. Provide food service training to any staff who may be asked to assist. Also, there are meal pattern considerations. All meals served in schools that participate in the federal child nutrition programs must meet the required meal pattern guidelines in order to be eligible for reimbursement. Menus should be planned, taking into consideration the needs to the specific meal service methods that will be used. For example, if meals will be transported and served in locations outside of the cafeteria, the menu planner will need to take into consideration whether schools have the hot, cold holding equipment that is necessary to allow for those service of hot meals, or if they need to plan meals that do not require food to be held hot. Consideration should also be given to the amount of time it will take for staff to prep for meal production and the time it may take to pre-portion or package menu items. It may be necessary to plan menus that require less staff preparation time. It is also very important to have a clear communication plan in place with staff and student households when providing meal accommodations to students with disabilities. Accommodations for disabilities that enable equal access to the program must be provided when supported by proper documentation. Meals must be served in a manner that offers a safe environment for children with food allergies. Staff must communicate and work closely together to ensure safe meals are provided when needed. Next slide. Another area of consideration is food safety. All schools and/or feeding sites are required to have individualized written food safety plans in place to ensure safe food practices. The written food safety plan must include standard operating procedures that are specific to the processes that are used within the site to mitigate food safety risks. It's important to review the current food safety plan at each school or feeding site to ensure that they include standard operating procedures for any new meal service methods or newly added procedures in place due to COVID-19. And most importantly, all food service staff, as well as any other personnel who may be involved with food service operations, must receive training on the standard operating procedures. There should be a greater emphasis placed on SOPs for hand washing, proper glove use, personal hygiene, serving safe food to students with allergies, cleaning and sanitizing contact surfaces, and the food service health policy. Training and communication is paramount to ensure that food safety maintains, or that the food service maintains a culture of food safety. The final key area to consider is operational support. It will be very important to have clearly written policies and procedures that are communicated to all stakeholders. Coordination and communication between food service staff, building administration, and other building staff, as well as student households, is important to keep everyone informed. It'll be important to share how communications will be received internally for staff and within the school building, and also externally with households. Examples may be, in non-CEP schools, how will the USDA meal applications be given to households and returned to the school so eligible children can receive benefits? Or how do families notify a school of the need for an accommodation due to a disability? Will menus be available for households to see? Will a la carte sales be permissible? Will vending machines be available? And can visitors come into the building during meal service times to eat with students? Having clearly written procedures and clearly communicating the answers to these types of questions will help program operations run smoothly. Finally, SCN has a variety of resources available to support you in your planning and implementation efforts. There are links to valuable resources available at the end of the KDE Meal Service Reopening Guidance document that was sent today. In addition to those, we are hosting a webinar for food service directors of the National School Lunch Program on June 25th. School food service directors have been notified of this opportunity. Also, we have dedicated staff that are ready to assist districts who would like additional help. If you would like to take advantage and request additional assistance, please send an email to the KY School Nutrition mailbox with the subject line COVID-19 Meal Service Operations Assistance Request, and we will be in touch with you. Are there any questions?
And if you'll notice in the chat feature, Lauren Moore has provided the link to the food service guidance. That should have also gone out by email to all superintendents. And it'll, of course, be posted on the KDE COVID-19 webpage for reference. If you have any comments, questions, concerns, feel free to raise those now. You can also add those into the chat. Just as a reminder of the feature of Microsoft Teams, you can come back into the chat even after the meeting has ended and add to the chat, and then the meeting attendees will obviously be alerted to that, and that becomes part of the meeting record. Sometimes that's helpful as well. Dr. Park, tell me make sure I described that capability correctly. I think that's correct. I want to thank everyone for your participation today. We have a very busy and important few hours and days ahead of us as we work within state government agencies to perfect and try to hone this healthy at school guidance. I also want you to know that as we keep talking about the various KDE guidance documents, on or around July 15th, KDE will have issued, including the one coming out Wednesday, around 15 guidance documents related to COVID-19. I want you to know that we understand that just because we issue a guidance document doesn't mean we think this is easy or that you should think it's easy. The guidance document is our way of telling you what we think you should be doing, not necessarily how you should be doing it. And that's when I think we reach our best decisions, because that enables you to utilize your district planning and do what's best for your community. Having said that, there are things in those guidance documents we've not even thought about yet that will come up. And just as you've heard the governor talk about his press conferences, how the Healthy at Work guidance document has changed, and that's why employers are encouraged to continue visiting that website daily. We envision that as we move forward, things can change, and we hope it's not because the virus increases, but we also know that we need to be flexible. So I want to make sure you know that this has been a very valuable conversation today, and I know Dr. White received a lot of good feedback on some of the things we're dealing with. I do want to note there is the exit slip. If we ask folks to fill that out, that's a time for you if you want to put something in there that you don't want in the chat, but I also want us to consider, as well as just some very quick feedback about how the meeting is operated and future agenda items, that type of thing. So please fill out your meeting slip. The next meeting is July 20th. Is that right? It is. It actually may be. It's July 20th. We are going to reserve the right to bring you back July 6th. Right now, plan on not having one July 6th because of the holiday weekend. However, we're going to see how the Healthy at School guidance goes over, and if we still are having some issues that need to be solved right then, just know that we're going to we could bring you back on the 6th. But as of right now, we're going to bring you back on the 20th, knowing that many of you will be traveling or at least maybe having some socially distant family gatherings or what have you that weekend. But we know that there could be some things we need to bring you back for. What I just said about the what to do versus how to do it. General Patton had a quote that addresses that, and I'll just leave you with that. It says that never tell people how to do things, tell them what to do, and they will surprise you with their ingenuity. I'm no longer really surprised about the ingenuity that we're seeing in school districts. I've come to expect it because, and that was on full display last semester, and I have no doubt that that's going to continue as we move on. So just know that we appreciate your feedback. You all have also my mobile number. If you think of things and you need to get to me, please email that or text that to me, particularly since you know we're going to be having these interagency conversations over the next few days. The superintendent webcast, again, is tomorrow. We will be going over some of these issues again, just for the benefit of the greater audience of your colleagues. But that is, again, tomorrow from 2 to 4. And then, of course, we're anticipating the governor's press conference on Wednesday to announce the Healthy at School guidance. Thank you again for what you're doing. There's a comment about potentially having a July 6th meeting because districts will be making our decisions. Completely agree. So let's go ahead and pencil that in as a possibility, and we'll let you know in a few days if we're going to have that on the 6th. Everyone have a good evening, and again, thank you for what all you're doing. Take care.